Is going to be the second video on sitting and posture. If you haven't looked at part one on sitting, please do so first because it's an important building block to this video. So some further thoughts on sitting. Last time we talked about how to set yourself up in a good position with sitting using the right positioning and the right pillows, and so forth. And try not to cross your legs too, which is a bad habit. Another habit with sitting that I've seen through the many years I've treated patients with back pain is the tendency to sit in a chair with arms, but lean into only one of the arms into your elbow. So I've seen folks put their arm on one of the arms on a chair and lean to the side, and that's a habit they have. If you don't know if you have that habit, if you live with other people, you can ask them to kind of be your little spy and look out. Also, just trying to be mindful. This whole process, it's called the mindful back for a reason. If you learn to tune in to your habits that you have and to your pain that you're feeling, you're going to have the best luck on getting on top of your back pain. You can't change what you aren't paying attention to, and that's why the mindfulness is so important. So next time you're sitting in a chair with arms, whether it's a dining room chair with arms or a big overstuffed chair, I want you to see, do I have the habit of leaning into one arm? If you do, I need you to change that habit. And depending on the width of the chair, you can either just take your arms off of the arms, or you can, if it's a narrower chair like a dining room chair, put both of your arms onto the armrests. So why is this important? Because in general, you want to maintain what's called a neutral spine position. And you're going to hear me using this term over and over again in this series, neutral spine. When you're in sitting, neutral spine is where you're just right in the center, that you're not off to one side, you're not twisted, you are not slumping forward, and you are not arching backward, but you're right straight up and down. Now, that's important because if you tend to lean off to one side or rotate, what that does is that ends up pulling on the muscles, tendons, ligaments, all the soft tissue on one side of your body. So the side that you're moving away from, it tends to pull on that area. And, it's one thing to do a quick stretch, right? But it's another thing to hang out in a position. And this stretch, this bad stretch, will actually increase your back irritation, inflammation. It's kind of like, think of it like a area of your body that wants to heal, but if you're constantly tugging on it, it doesn't have a chance to heal. You're keeping the irritation going. So you want to get in the habit of checking in with what you're doing in your body and say, whoop, I'm leaning into one arm. Let's get back in the center in neutral spine position where my back has the best chance of healing. I hope that makes sense. Also, if you have a tendency to lean towards your bad side, a lot of folks have pain off to one side. So say my back pain was on my right side and I had a habit of leaning into the arm on an armchair towards the right. What that does is that actually compresses the vertebrae and the facet joints, all the joints in the spine on that right side. So just visualize compression on the side you're moving towards. And what that does is that ends up having a higher likelihood of pressing joints together that are irritated and inflamed, and also pinching nerves that go out of that space. So we have nerves that come out of our spine on both sides that go down, and each level of the spine has those nerves. Now in the low back, in the lumbar spine, those nerves go down your back, through your buttocks, through your legs, all the way down to your feet. So if you're somebody that has sciatica-like symptoms, numbness, tingling, sharp shooting pain in your legs or buttock or feet, you can be irritating that nerve that makes those symptoms by compressing the nerve further, leaning off to one side. Okay, so try to break that habit, check in repeatedly with your body, and if you do find yourself leaning off to one side, just bring yourself back to the center. And if it's a strong habit, you may find the second you think other thoughts, you go back to your habit again. So it takes repetition, checking in with your body repeatedly over time, over weeks to months, to really change a really strong ingrained habit. And I promise you can change it. But remember, you can't change what you're not noticing. So tuning in is the first step. And if you find this video helpful and you'd like to see more of my videos, please look at the other videos in the playlist listed below. Also, press that blue like button if you found this helpful so that the YouTube gods can know that I am providing useful information to you. And also subscribe if you like more than just one video and you'd like to see more videos that I post. Press that red subscribe button right below. Thanks so much.